Hi, my name is Adam Connell. I'm a nurse here at the hospital and I work in the Department of Psychiatry. I imagine that if you're watching this video, things are not going exactly how you would like them to be going. I'm really sorry things are crummy and I'm glad that you're here. I want to talk to you about a program called Dialectical Behavior Therapy, or DBT. It's a program that was created by a brilliant psychologist by the name of Marsha Linehan and is designed to help people be more effective at managing their emotions. I'm thinking someone in our emergency department provided you a little booklet about DBT, and I would like to briefly go over it with you. The handbook that was provided to you is the same thing that we use on our inpatient psychiatry unit for kids. We thought you might as well have access to this while you're waiting down here, regardless if you're admitted to this hospital, somewhere else, or you are not admitted at all. I'm going to briefly talk to you about the basics of DBT, and then you can hopefully learn more by reading the materials that were provided to you. DBT stands for Dialectical Behavior Therapy, and it's a treatment program for adolescents and adults that is supported by a ton of research. Let's break down each of these three words. Dialectical means two opposing ideas that can be true at the same time. You can be super annoyed about being in our emergency department and also acknowledge this might be helpful for you. You can be really frustrated about how things are going in your life right now and also be hopeful that things will get better. Viewing things from a dialectical perspective helps us get out of the black and white all or nothing thinking. It allows us to see shades of gray and potentially open up space that we have never explored before. Behavior in dialectical behavior therapy refers to possibly changing your behaviors. Intense emotions often cause people to respond in problematic ways that interfere with their goals. In DBT, we try to replace these maladaptive behaviors with more skillful responses so that we can get closer to living the life that we want. Lastly, therapy is the treatment of a disorder or a problem. We're going to try and teach you evidence-based strategies that will allow you to treat and solve your problems. There are four main sets of skills in our program. These include mindfulness, distress tolerance skills, emotion regulation strategies, and interpersonal effectiveness techniques. We are hoping you will learn mindfulness skills so that you can spend more time staying present in your life and become more effective at skillfully responding to situations. Distress tolerance skills are crisis survival skills. We want you to use these skills when your emotional intensity is so high you can't really solve your problems. These skills are designed to minimize the damage and not make things worse when you are in crisis mode. Emotion regulation skills are used when the intensity of your emotions has come down a bit and you're at a point where you can solve your problems. Lastly, interpersonal effectiveness skills are basically relationship strategies. We're going to teach you how to maintain your self-respect while learning how to keep and maintain healthy relationships. Also, how to skillfully ask for something or assertively say no. Now that you know some of the basics of DBT, it would be great if you could open the handbook that was provided to you and skip ahead a few pages to page number 4. Please read the first paragraphs under Part 1, Support Level Introduction. After you've read this brief introduction, please check off each statement that applies to you under mindfulness, emotion regulation, distress tolerance, and interpersonal effectiveness. Each check mark that you make may indicate an area that you need to work on. Please feel free to go through this handbook at your own pace. This first part will provide more information about DBT, introduce the main goal in DBT of having a life that is worth living, describe the difference between willingness and willfulness, educate you on a really important skill called radical acceptance, and orient you to numerous crisis survival skills. Crisis survival strategies that are mentioned include distraction techniques, self-soothing, creating a crisis survival kit, turning the mind, and making a safety card. It takes a ton of courage and bravery to acknowledge that things are not going exactly how you want them to be going. We are really glad you're here and are hopeful that some of these DBT skills can get you closer to living the life you want. The second part of this handbook focuses primarily on skills that you can use to become more mindful, become more effective at regulating your emotions, and improve relationships with yourself and others. If you are admitted to this hospital, we have lots of staff who are trained in DBT who can help expand some of these ideas that are introduced in this handbook. If you transfer somewhere else, or if you're not admitted, I encourage you to review these materials with a mental health professional in hopes of broadening your understanding of DBT. We really appreciate your willingness to watch this video and to check out the DBT materials that were provided. Best of luck and take care.